Hello, and thank you so much for joining us today for our event. My name is Maya Jacomowitz. I'm the Vice President for Evidence-Based Policy Implementation at Results for America, and I'm really pleased to welcome you to today's session, which is focused on highlighting comprehensive local approaches to improving economic mobility. Today, we have the opportunity to learn from local government representatives in King County, Washington, and New York City about their work and their lessons in creating multifaceted approaches towards advancing mobility outcomes for their residents. And today's session is focused on highlighting two foundational points of learning. One is that improving economic mobility can only be accomplished with comprehensive, coordinated approaches. And that's because the forces that have contributed to stagnant levels of economic mobility are powerful and interconnected and deeply entrenched. And second, that local governments can improve economic mobility outcomes for their residents and have a very important role to play. Now, we're going to be using our time as follows. Kosar Jahani from the Bill and Melinda Gates Foundation will begin with opening remarks, and then we'll transition to a panel with Sheila, Capestany, and Matt Klein from King County, Washington, and New York City, respectively. And that'll be moderated by Simone, Brody, my dear colleague at Results for America and What Works Cities. They'll be highlighting the work that they're doing locally and their successes, as well as their challenges. We'll then transition to another one of my great colleagues, Ross Tilchin, who will present on Results for America's Economic Mobility Catalog, which attempts to address several of the challenges that will be lifted up as part of the discussion. Throughout this event, please do use the chat box to ask any questions or insert any reflections that you have as the conversation is going. We will work to raise up any questions that you have during the event. And there'll be time for questions both at the end of the panel discussion as well as at the close of the event. And now it's my pleasure to introduce Kosar Jahani. Kosar is a program officer with the Economic Mobility and Opportunity team at the Bill and Melinda Gates Foundation. Prior to her work at the Gates Foundation, Kosar served as the Director of Impact at Samasource. They're a leading social service enterprise that employs low-income people from around the world to conduct digital job projects and lift themselves out of poverty through dignified work. Thank you so much, Kosar, for joining us, and I'll be handing it over to you now.
Thanks, Maya. Thank you for having me. Really great to be here with this panel and this audience. As Maya mentioned, I work at the Bill and Melinda Gates Foundation, where our interest in economic mobility and access to opportunity stem from the origins of our work in the US. For those of you who might be familiar with the foundation, that has focused primarily on education. But as we all know, despite decades of national economic growth, rates of upward mobility have remained fairly stagnant over the last few decades within this country. And we know that upward mobility or experiencing upward mobility and access to opportunity requires a much more holistic approach. And to change that national trajectory, we all need to focus on solutions that are both at the federal level, but also at a very micro and local level. What we do know about upward mobility, and I'm sure most of the people in this audience are familiar with the work of the Opportunity Atlas, is that when you're thinking about upward mobility, place matters. It matters at a macro level. So thinking about regions of the United States and where a community is situated and given the specific history and context of that community, but also at a very micro level. So neighborhoods matter, and even blocks, adjacent blocks within neighborhoods matter. And that's where we see local governments playing a huge role in improving kind of the landscape of access to opportunity and that upwardly mobile trajectory. With that in mind, our strategy at the foundation has really focused on what types of tools local decision makers need to improve rates of upward mobility. Today, we're going to hear from two of those local decision makers, Matt Klein, the Executive Director of the New York City Mayor's Office of Economic Opportunity, and Sheila Capestany, Director of the King County Division of Children, Youth, and Young Adults. The work that Matt and Sheila have been doing are two really powerful examples of the capacity of local government to really drive progress in improving economic mobility. And following the panel, I'm really excited to have Ross introduce you all through to a virtual walkthrough of this economic mobility catalog that Maya alluded to. One of the things that we've hear oftentimes in our work over and over again is that local communities are really hungry for understanding what works at a local level and what other communities similar to theirs have done, what programs and initiatives they've implemented, and how they did it. And the economic mobility catalog really is a response to that need. So I'm very excited to kind of preview it with you all today, and then hopefully get some engagement from the audience on that afterwards as well. With that, it's my pleasure to hand it over to Simone Brody, who again is the Executive Director of the What Works Cities Initiative, and she's going to kick off our panel.
Thanks, Kosar. Hi, everybody. I am thrilled to be here with all of you and so excited to chat with and learn from Matt Klein and Sheila Capestany, as was mentioned. They are two just incredible city leaders that have really built models for how to drive meaningful opportunity in their communities. So really excited to learn from both of them today. Matt is the Executive Director of New York City's Mayor's Office for Economic Opportunity, and Sheila is the Director of the King County Division of Children, Family, and Young Adults, and leads the Best Start Initiative for Kids. I could go on all day about their backgrounds and the incredible work they've done, but I will let them speak for themselves. And I will start maybe, Matt, with you and ask you both to just share a little bit of a description of the initiatives that you all have led in New York City.
Thank you, Simone, and thanks. It's great to be here with friends from Results for America. I've learned so much from the network and from your work, so thank you for having me. So I direct something called the Mayor's Office for Economic Opportunity. Our mission broadly is to help the city of New York apply evidence and innovation to reduce poverty and advance equity. And we try to do that with three main themes to our work that we hope are mutually reinforcing. One is to identify and promote what works to reduce poverty, and that's to help the city allocate resources to those strategies that get the best results. The second is to improve the social service experience for residents, to help it be more coordinated, more effective, more tech-enabled. And the third is to generate research so that we have a better understanding about issues of poverty and can respond in ways that are more effective and attuned to the needs of the folks who are experiencing challenges. So just quickly on our origins, we had our origins in the Bloomberg administration. Mayor Bloomberg and then Deputy Mayor Linda Gibbs convened a commission for economic opportunity to think about how the city of New York could address poverty more effectively. And they made a number of recommendations, one of which translated into the creation of a new unit that would focus on developing new ideas and measuring poverty in a way that was more precise than we had previously. That work continued generating a number of effective models, and I joined the office after Mayor de Blasio started. And since then, we've done some reorganization of different units that were created under Mayor Bloomberg and Linda Gibbs and expanded those offices. And so now the entity that I run is the Mayor's Office for Economic Opportunity. And we combine both the effort to develop new initiatives and evaluate those, but also engage in a broader work around human-centered design, around data integration, digital and technical tools, and evaluation work. And I can talk more about that as we get into the conversation.
Great, thank you, Matt. Sheila, would love to hear a little bit about the Best Start for Kids and how you started the work.
Wonderful. Good morning, everyone. I'm really happy to be here. I am the director of our Children, Youth, and Young Adults Division, which is actually a new division and was inspired by our work through Best Starts for Kids. So that's an interesting point about a creation of a division within a government that's inspired by a levy. But the Best Starts for Kids is really my heart work and the big work that I do for the county. Best Starts for Kids is an initiative that is at this point, about a $400 million over 6-year levy. I say at this point because we are in the last year and we're looking for renewal in August for the next 6 years. It is a comprehensive initiative, so we provide services in policy and programming from prenatal to age 24. It's deeply grounded in the research around taking a life course perspective to childhood. So looking at brain development, looking at what are the appropriate times to deliver certain types of services. One of the unique things about BSK, besides its comprehensive nature, is that it is about promotion of well-being first and foremost, and then it's about prevention and early intervention. It is not an initiative that does a deep dive into intervention, but really talks about how do we get upstream, both age-wise, so start from the very beginning, but also in the types of issues that we're addressing. It's very common, of course, for counties are obligated to provide for what that safety net or sort of the end of the line type of services when things go wrong, like the criminal legal system and behavioral health system. But this county really decided that we needed to also be making investments more upstream. So when we, talking briefly about the origins, Best Starts for Kids was sort of a twinkle in the eye of our county executive in 2014, as he started to learn more and more about brain research with infants and the incredible growth that happens in that early time in humans' lives. And that's where this idea of having this initiative started. At the same time, we also had a council that was working on youth issues. And through a lot of working across the legislative body and the executive body, Best Starts for Kids was born to be this comprehensive prenatal to 24 initiative. It involved, from the very beginning, was community driven, lots and lots and lots of community engagement and partnership in designing the initiative and what we would be investing in. And it also involved just folks from all kinds of different fields. If you're doing a comprehensive initiative, then you're really talking about folks who provide those early supports, folks who are working within our economic success areas, folks who are working in our academics, all of the different people that we needed to bring to the table to create this initiative was pretty amazing, comprehensive, and mind-blowing. Underneath Best Starts for Kids, we actually managed to come down to 4 words to describe what our goal is for our young people, and that is happy, healthy, safe, and thriving for all of our children, our babies, for our youth, our young adults, for our communities. Happy, healthy, safe, and thriving. So that is our North Star. It has become the 4 words that we use for all of our programming in our department for young people, and it's the words that the county itself is sort of moving towards as we think about what we're trying to create out of this initiative. So I will stop there.
I love that aspiration for kids and adults. And so I would love, you talked a little bit of both of you about the comprehensive nature of this work. And there are so few government programs like these that are comprehensive and really take a very broad perspective to addressing poverty, to thinking about, cradle to career, kind of whole child. And I'd love to hear a little bit about those challenges, right? Like they're driven based on how government is structured. They're driven by the real challenge of collaboration, even when there's alignment on outcomes. So a little bit about the challenges as you all set out and have been building this work, and what some of the keys to success or kind of keys to break through some of those challenges were. Maybe Sheila, ask you to go first.
So as is typical of something this large, I would say our challenges are similar to what our successes were. The things that were the hardest for us to do that we were successful at, I want to talk about. So the first was really at its core, Best Starts for Kids is really about responding to what the community itself says that it needs. So the real big challenge that we had was, how do you authentically partner with community? How do you authentically listen to what community says they need? And one of our challenges as government and researchers is that we have our data, we have our ideas, we have the outcomes that we think that we should be achieving for communities. So how do you actually work with communities and assure that the outcomes that they want to achieve, what they understand is important for their community, is actually incorporated into the work that you do? And I would say that was one of our successes. We really managed to shift to a way of thinking that we have a resource, which is data and information and funding. And communities have a resource, which is knowledge of what their needs are, knowledge of who they are and how those programs need to work. And then you partner those two. And when you're able to successfully partner that, you come up with programs and services and policy frames that are going to be far more successful for where you're trying to implement those. I think the second challenge that we had, which was really big and boring, but the hardest was actually coordinating and shifting and changing the way that we did things within the county. We had a particular way of contracting. We had a particular way to think about risk. We had a particular way of putting our RFPs out there for folks. And we had to really shift. It was, trying to shift the Titanic in the ways that we had to do some of the change that we did. And we have been mostly successful. We've got a long way to go, but we really had to question why we contracted with our agencies in the way that we did, how we put our dollars out there. BSK was fairly successful in that we, one of the things we heard very strongly from our communities, it was hard to access the funding. And so we hired community consultants who were able to work with people and provide TA in order to make applications. So 60% of the people that we funded, the organizations, had never received government funding before. And we represent many different languages and cultural and ethnic groups. So we are receiving constant feedback about our processes and how we have to shift those. So we're really trying to do the hard work internally to create a county that is more responsive and able to still track. It's still public dollars, and we want to be guardians of those public dollars, but also to have systems that work for the public. So that's been a really big challenge. And I would finally say for King County, a big challenge is coordinating across a vast geographic region. So King County is larger than 15 states in the United States, and the coordination across the two major urban areas, one everyone knows is Seattle, but Bellevue is a large urban area. So two large urban areas. We've got suburban areas, and then we have very rural areas where access to services is really difficult. So being able to have an initiative that responds to that need across geographic needs as well, and very, very different infrastructures across our county for human services and public health services, that was a really big challenge for us as well. So we'll stop there.
Thank you. I think we could probably learn so much on each of them. I'm going to pick the first one to ask you to go a little bit deeper on, which is we are hearing a lot from governments, always, but certainly even over the last 9 months, really trying to think about how do you have more inclusive, comprehensive engagement with residents, both from the perspective of understanding resident need, but also providing that feedback loop so they can hear how you are taking that feedback and taking action. And so would love to hear any of the strategies or what worked particularly well, what didn't work, and really understanding not just sort of like average need, but getting into the communities that you most needed to serve and hearing those voices more fully.
Okay. Well, that's an interesting question. It gets very deeply at a philosophy that I have that I brought in leading BSK, which is there's always like 3 or 4 or 5 good ways to do things. And as government, we always think that the way that we've chosen is the best way. And often it's just one of those 3 to 5 good ways of doing something. So if you embrace that idea, then you're going to be much more open to what the community has to tell you about what they think is the direction to go. Because more than likely, there's another really good idea out there. And if you can be flexible enough in your concepts of what it is that you want to do to really hear that and listen to that, then you can choose a different path that is more community oriented. But one example, we do ongoing community partnership, but one example of how we launched this initiative was when we were coming down to a vote and the levy had passed, and it was like, okay, now we have an okay for funding, and now we need to figure out what we're going to do. I led a comprehensive community engagement process where we went out every single week. We're doing 2 or 3 community engagement, community conversations all over the county. And we would have 100, 150 people attending these events. We did it as the community conversation. So there were tables that people could go to and give their input. And we outlined sort of, this is what we're thinking about. Our main question was, if this is our frame, what are the programs and services do you think your community needs? What would that look like? What do the kids need in your community? And we took all of that information and we brought it internal to create what was our implementation plan. What was also unique for our county is that we engaged a lot of people who work within the county, but not necessarily on these particular issues. We used our community engagement tactics inside our government. And so we asked people, who wants to be involved in this? We have all this information from community. We have all this information from the research and science that tells us. We want to combine those two things and come up with this comprehensive implementation plan. So we had about 150 folks come forward from within our government to form different work groups. And again, some of them were directly from Human Services and Public Health, but some of them were from transportation. We had some from our Economic Opportunity Office. We had admin support folks. We had people who were directors of divisions, all coming together to figure out how we brought all this information together. Once we finished our implementation plan and before we got approval of that through our legislative process, we went back out to the community, to all of the community groups that we had gone to, and we spoke to over 2,000 people. We went back and organized those groups, and we said, okay, we asked you what we should do. This is what we heard, and we wrote it all down. Did we get it right? So that was the biggest question. Did we get this right? And after every single meeting, I would come back with my staff and I say, okay, what did we hear tonight? Mostly we heard, oh my goodness, you got it really right. Like I said that thing and it's now in your implementation plan. It was beautiful that way. But there were some things that we heard new during that we thought, well, we missed that. And so we were constantly changing that plan until it was truly reflective of what we heard, reflective of something that was high enough level that it could apply in an urban area and in a rural area, just with different ways of implementing. So by the time we were ready to really launch Best Starts for Kids, we had gone through a process of asking what we should do and then vetting that we had heard correctly what it was that we should do. So that's an example of a really comprehensive, we did too quickly. I think a process like that can take 1.5 years. I had 9 months. And so we stacked things on top of each other. You need to make sure you're properly staffed to do that kind of work. We weren't. But it's possible to do that deep of an engagement. And then you end up with an initiative that truly can be owned by the community and reflect community need.
Thank you so much. I think that so many of us have a lot to learn on that engagement piece and really having the programs that we are creating in communities be driven by what we're hearing from residents. Matt, I am sure there were 1 or 2 challenges and breakthrough moments in New York City as this work launched and then continued to grow, frankly, to today. So I'd love to hear about them.
Yeah, well, it's also great to hear about the challenges of King County, that lots of that resonates as well. So what I would say is some of the things that sound simple are just very difficult to do in practice, like use data and evidence to make decisions, be resident driven and listen to people's priorities. Those sound like very simple concepts, but executing them is very difficult. So, data, are we capturing it? Are we actually reviewing it and acting on it? Is the data even available? When we're using metrics, are they defined similarly so that we can actually compare to make relative comparisons? The burden on organizations to produce the data, enter the data into mandated government data systems. So just capture the data and make decisions is difficult. Evidence is hard. Often evaluations are mixed. It's not clearly an up or a down. There's also, kind of the tension between, well, we did this program, the RCT said it worked. So now it'll work forevermore in whatever context we put it, versus like a performance management approach, which is capturing and looking at data, but may not have a comparison group. So for example, we had a program that was showing what we thought were good outcomes for disconnected young people connecting to work. But when we did the evaluation, they didn't do any better than the comparison group. So without both evaluation and performance management and the willingness to engage with nuanced results, all of that makes it harder than it might sound. The listening to residents and user-centered design, as she was saying, it takes time. It can reveal critiques. So, the aim is to understand how programs and services work, not how we think they work, but how people actually experience them working. And that reveals challenges, and then that can be embarrassing to agencies. And it's also extremely granular. So not only in sort of the big priorities of the community, but actually like, how does the homeless system work for someone who's homeless? How much notice do they get prior to changing shelters? Like very granular things that have really meaningful impact on people's lives that have to affect how we do our work and whether we get good results at the end of it. So, so for the New York City is very big, as you well know. 8.5 million people or more, growing, billions and billions of dollars worth of social services, just beyond the safety net that the government delivers directly. We contract $5-6 billion worth of social services to thousands of community-based organizations. So as a unit within government, we're about 60 people now, multidisciplinary team, but very small relative to the systems of government. The challenge is, how do we organize ourselves so that we can improve how the system of government works for low-income residents? So some of the things that the way we've organized ourselves, some of them were around right from the beginning, and some of them have been integrated and developed over time. One is an innovation fund, so dedicated dollars to try new things, unrestricted, and the notion is you try things, see what works, grow them, and what doesn't. We developed a service design studio, so have folks who are skilled in human-centered design who actually have the practice of engaging with communities and looking at the real lived experience of people in services and having that help reflect how agencies do their work. And so they've been in huge demand. I know that's growing around the country, but there's so much to learn. Any way you throw a dart, there's something to fix. Evaluation, so growing from not only evaluating a pilot program, but being in service to all of our agencies to evaluate signature initiatives, whether that's pre-K for all or community policing or community schools. We have an evaluation team and contracts with external evaluation partners that allow us to perform that as a service with partners through government. A lot more on digital technology and products. The pandemic, I think, has only accelerated this notion of how we engage digitally and ensure that the experience of people engaging with us digitally is better. And so we brought in-house a capability to do lighter weight technology developments, be able to grow and change technology tools as we're learning from how they're actually being experienced by people who use them. Another strand is enterprise data integration. So a common challenge is, same families engaging with multiple agencies. Agencies don't know it. Or we're trying to target people who are likely eligible for a particular service. How do we find them? So increasing the amounts of integrating data from across agencies. And then finally, doing citywide reports. So we measure poverty every year using a methodology that counts both after tax and in-kind resources, but also accounts for the higher cost of living in New York City, and have started also producing an equity report, very inspired by the work of King County and its equity work, and we've been trying to institutionalize more of an equity lens into the practices of government, and that includes publishing disparities around key social indicators so that we can hold ourselves accountable and think about how equity is core to performance management. So our challenge has been to try and think about how you move this big system with discrete tools to enhance places to make it work a little bit better. Some keys to success on our end. And some of these are just like keys to success of being in a bureaucracy. And one is having funding helps. The innovation fund helps. As we've turned inward to try and think about how to nudge big systems, we've done things like call for collaborative innovations, asking agencies to tell us how they would want to work together better on behalf of folks they're serving, and then making funding available for that. Second, and very related, is buy-in. When the mayor gives a mandate, things can really happen across agencies and in collaboration. But when that mandate isn't there, it's very hard to sustain ongoing, shared work that thinks beyond the very already difficult job that any individual agency has. So having the buy-in of executives is critical. And then I think that just the technical capabilities can help with that, whether it's like the evaluation contracts, service design methods around facilitation and prototyping, digital tools to be able to work quickly and get things out and fix things. So those are some of the things that I think help us work within this big system to not only like innovate in the small areas, but also think about how to move on economic mobility at scale.
Thank you. That's great. I think we could also go on for a long time with all that you've answered. We're getting some questions. I will ask if folks have questions, please drop them into the chat. We're already getting some, and we unfortunately have 7 minutes, so we're going to try to get to a few, but I know there's so much that this group can learn from both Matt and Sheila. So I'll tell you two, and maybe you guys can pick which ones. I think one is around sort of how would one get started? How do we think about, as a city leader sitting in government, what are the kinds of things, what is the sort of like groundwork you need to do to start to build momentum? And then a second one focused on some of the emergency policy changes that have occurred during COVID, both locally and at the federal level, that have gone well, and we should sort of think about continuing as it relates to this work. I will open it up to either of you to take one, and then maybe the other can address.
Well, I will tackle so far the emergency policy changes, because I think it's the thing that's on everyone's mind, particularly with an initiative like Best Starts for Kids. That it is a funding source, and we have created a policy framework and an initiative and something with a theoretical foundation, but at its core, it's a funding source. And so as we looked at what was happening with COVID and what was happening in our communities, we completely shifted this year all of our contracts with our community-based organizations. And we asked them, what do you need? Like you are on the ground, you see what's happening with our communities. What do you need to be doing? We had to be willing to let go of some of the outcomes that we were looking for. We had to redefine what it looked like to support families and communities. We had to re-look at what it looked like to provide services. So we made that shift. I think what we're going to see is that there's no going back to the way things were. I think some really creative, innovative things came out of our COVID response that we need to continue forward with. The blending of how we do things like in a comprehensive home visiting program. The times have changed, not only because of COVID, but in general, and people use social media more, they use other platforms. So doing a combination of virtual and in-person and saying that that's okay. The flexibility that we built into our contracts is something that the community is saying, we want this going forward. I don't know what we're going to be able to do with that, but that's a really big ask of us right now, is how do you have flexible funds so that communities can aim for an outcome, but be flexible in how they get there. And so that's what we're right now wrapping our head around. And I think that's a really good for us to have been asked. It is a COVID response, but it's a great question in general, I think. So I'm excited for us to be able to tackle that.
I love that. And then picking up on it, one of the things we've seen a lot of in COVID response is cash assistance. And I think there's a broader recognition that works, that helps. And I think that's going to influence how we think about mobility going forward, and should influence. There's obviously a discussion, and has been, through the presidential campaign, that got elevated around universal basic income. But putting that aside, the child allowance, child tax credit, which is a reflection of just getting cash into people's hands that's now pending, could have, historic impact on poverty and long-term mobility. I think we're also got to look at how cash can complement and be part of existing social services. So for example, paying rent arrears to prevent evictions, or subsidizing training and so that people can do upskills but get paid during the period of training. There's many places where pure cash that we've seen be effective, and as everybody's been impacted by the economic crisis, can become a more meaningful part of the ongoing strategies, I think. I forget what the other question was.
The other question was about how you get started, and I'm going to add a question to that because more keep coming in, which is sort of how you get started in general, and then for cities and communities that are not the size of King County and New York City, how might you think about tackling this, where there are individual programs that are trying to address economic mobility, but not the resources yet to think about comprehensive strategies? So I'll combine those.
I can go quick so you don't, so Sheila doesn't have to go first every time. But so I think, in the case of New York City, having a commission that, of different kind of stakeholders from public, private, nonprofit, making recommendations was a helpful momentum builder. I would say even in the absence of that kind of process, there's individual pieces that can be helpful, even at very small size. A designer, like a chief experience officer, someone whose job it is to be thinking about how do people experience the government as a human. Often we're just thinking about designing the system as a system and not how people experience it as a human. Or relationships with academia, or paying evaluation firms, just to have a capacity at some level to introduce the kind of practices that requires, and then can be spread more broadly.
I like all of that, Matt. I also think for that question, I think that there is, when you are in a smaller community, whether it's a city or a rural area in a particular part of a county or whatever it is, when you feel like you're smaller and there's some limitations in that way, I think two things are really important to think about. One is the difference between comprehensive and connected. I think that BSK had the opportunity to do prenatal to 24, but if we had taken all of those dollars and decided not to go breadth, but to go depth, we could also have a huge impact. So figuring out within your own community, what is the one or two, or five if you got those resources, but even one or two that you can invest in deeply, that if we invest in these things, we can trigger sort of a cascading positive effects. I think that's a really important approach too. So figuring out how wide do you want to go, or how deep do you want to go? And comprehensive does not mean wide necessarily. It can mean deep. The importance is how you connect whatever it is you're doing to other things that are happening, because then you can leverage your resources better. So within your own government entity, leveraging what else do we have going on? Well, we have this really successful office over here. And actually, if we take these investments and we go deep, we can connect it with the work happening here. For us in King County, we're big. So we've got several levies that I am constantly watching to see what they're doing and saying, oh, well, BSK can do this and leverage what's happening over here. And believe it or not, we have an initiative called PASTA, what's happening in our PASTA initiative over here. So we can leverage those things. So thinking about connection is just as important as comprehensiveness, or whether you're going deep or wide. The other thing is looking outside of yourself. And I think, Matt, you were talking about this, is who are your partners? What can you leverage that's outside of your entity? Who else can you get involved in the work that it is that you're trying to do? And there may be within your community folks who have either resources or ideas that can be leveraged to come together and create something that is bigger than what any one of you would be able to do. So I think both of those things, in doing that kind of deep analysis, can lead you to some really innovative, creative, and important things for your own community.
Thank you so much. I'm gonna sneak in one more question. Sorry, coordinators, it's gonna combine a few around sort of this broad question of data. Thinking about, are there certain outcome measures that you are most focused on? There's a question here about sort of new data from the 2020 census and how that might add to our sort of rich knowledge of what we're thinking about on economic mobility and how we might leverage that. So maybe a broad question about, are there kind of critical performance measures, and what are new data sources, the census, others that you're excited to get to really get a more holistic picture of impact?
So our key metric is poverty and near poverty, and looking at how many people move up and out of poverty. That's something that we can get an annual snapshot of. An annual snapshot is not as good as an ongoing picture. There are others in New York City who do panels, for example, so we get a sense of people going in and out of poverty and what that looks like. But I would say our core metric for our office, and that we try to make sure is always a core metric for the city of New York generally, is what is our poverty rate and near poverty rate, and when we moving people up over it. I will say a challenge, just to note this, of doing that at scale is what it takes to act, the doing that at scale is difficult to move those numbers. And the thing that's moved the numbers the most for us has been the increase in the minimum wage, which is now at $15. That moved hundreds of thousands of people out of poverty or near poverty. And that's something that as a city we had to advocate to our state for. The only other quick thing I'll say about data is, I think it's a very exciting time. I think, Opportunity Insights is doing incredible work. We're partnering with them to better understand over time mobility and what policies or practices contribute to that mobility that we can do more of. I think the advances in data and technology allow us to use administrative data more quickly and more ongoing way to look at performance, so we don't always have to rely on like a formal evaluation. We can be looking at what's going on in a more real-time way, and also integrate to think about how to support people more holistically. So I think it's a very exciting time about using for data as we're making advances, and some of the big challenges about the silos in government. It feels like we're at a point where that might shift using new technology and data tools.
If I can just, I'll take a quick minute to piggyback on that, because I think all of that I would agree with. And we with Best Starts and with a lot of the work that we do, we have our headline indicators. So there's always the sort of points that you are going for. And I think that those are important to have, because you need to know what your indicators are. I'd like to just bring up that evaluation is so important, so that we all know that what we're doing is actually triggering what we hope that it's doing. And data is something that we have collected and talked about and done to and with and for decades. I think that there's a lot of bias in the way that we collect data, and with Best Starts for Kids and King County's work that we've done around racial equity and social justice, we've really started examining what kind of data are we asking for? Are we asking the right questions? Are we looking at it in the right ways? Are we aggregating it in ways that hide things? And we're really trying to follow the lead of a lot of folks who are doing some really deep work in this area. I would call out Abigail Echohawk, who is a national leader in decolonizing data. And what does that mean? And how do we collect it? And how do we analyze it? And who owns the data once we analyze it, once we collect it? We did some really interesting work around getting community to help us figure out what data points we wanted to collect, doing all of that work, and then taking the data back to community and asking for their analysis of it. So I would put out there that we have all of these innovations, and yes, and big data, all of that is super important, but we also need to be asking the racial justice and equity questions about how did we get this data? What does this data mean? And who is the person who gets to analyze it and tell us what our next steps should be? That's a really important part of this conversation.
Thank you. That is a good note to end on, though also a good note to begin on for a whole nother set of conversations. Matt and Sheila, thank you so much for just the incredible impact you are driving in your communities and for being here to share them with us today. Really appreciate the time.
Thank you very much.
And now I am very excited to turn the conversation over to my great colleague, Ross Tilchin, the Associate Director of Economic Mobility at Results for America, who is going to share our exciting new economic mobility catalog.
Thank you so much, Simone. Let me just share my screen here. Okay. So thank you again to all of you for being here, and thanks to our panelists. Matt and Sheila for joining us, and to Kosar for introducing the event. I'm Ross Tilchin. I'm the Associate Director of Economic Mobility at Results for America, and I lead the Economic Mobility Catalog Project. This is a tool to help local government leaders and their partners identify and implement evidence-based strategies across the full policy spectrum to improve economic mobility outcomes for their residents. Our ultimate goal with this project is essentially to help more local governments do what King County and New York City have done thanks to leaders like Sheila and Matt, and that is to create multifaceted, coordinated strategies to improve outcomes for individuals at every stage of their lives. As we heard in the panel, we recognize that this work is tremendously difficult. Standing up even one intervention is not an easy task, and to coordinate strategies across department to create supports for folks at every phase of their lives, that's a really complicated undertaking for local governments. But at Results for America, we believe that local governments can and should be playing a central role in improving opportunity for lower income children and families, and that racial equity needs to be the guiding principle here. In nearly every city and county across the country, disparities in outcomes between white and non-white communities are stark. So to improve economic mobility, local governments need to be focused on improving the landscape of opportunity for communities of color, and it's important for us to state that clearly. So back to the catalog. This is one aspect of how we seek to support local government leaders. It's a resource that's built specifically for folks in local government and was developed through an extensive user testing process. So we interviewed over 24 local leaders. We really wanted to get into their heads and understand the day-to-day challenges that they face. So we were asking questions like, how are priorities set in City Hall or in the county executive's office? Where do local government leaders look for new solutions? What sorts of information feel really useful, and what information is less useful? So we took our findings from those interviews, prototyped a few versions of the catalog, incorporated the feedback that we received, repeated that process a few times, filled up a lot of local government leaders' inboxes, and created the catalog from there. So I'm going to walk through some of our learnings that we took from our interviews with local government leaders, and then talk about how that informed the development of the catalog. So our first finding was that local governments and their partners often are lacking a shared framework when it comes to economic mobility. Economic mobility is big, and it's long-term, and it can feel a little difficult to wrap your arms around, and particularly, as Matt and Sheila were discussing, as local governments try to work across department within government, but then also with their partners outside of government, without a common understanding of what economic mobility consists of, and without an ability to set shared goals, align on similar targets, it's really difficult to make that collaboration feel fruitful. So the catalog is built around an outcome framework, and that guides the entire organization of the site. So if you look in the right column, starting with Explore Local Strategies by Outcome, we created this outcome framework from the work of the Strive Together Network and the Urban Institute. And it gives the ability for our users to sort through strategies and search for strategies by specific outcome and by life stage. So we start with things like family stability and neighborhood supportiveness, and then we go all the way through the life cycle, starting at early childhood outcomes all the way to high quality employment for adults. Our second finding was that local government leaders know that there's no single intervention that can improve outcomes by itself. And they recognize the importance of taking a comprehensive approach to improving economic mobility. But it can often be really hard to find the right sorts of complements to put together a comprehensive strategy just for one outcome. So in the catalog, we try to make this easy. So again, drawing on the outcome framework, each specific outcome presents users with strategies across the policy gamut that have demonstrated in high quality research positive effects in that particular space. So in this example, if a user was interested in searching for strategies that help to strengthen families, they would come across this page that points them towards options in health, in workforce development, in justice and public safety, in housing, et cetera. And then a click on any of these boxes on the right side brings you to a page that presents those strategies in more detail. So our next finding is a big one and a tough thing for an online resource to address by itself. Local leaders often struggle to make the case and build momentum for longer term investments and strategies. So this is not something that's unique to local governments. Leaders at all levels of government are often drawn to actions, to investments that produce immediate returns and preferably highly visible returns because they want to take credit for their actions, understandably so. The problem is that many of the most important investments that local governments can make in improving economic mobility, so from early childhood supports, public health investments, ensuring affordable and safe housing, those sorts of interventions don't necessarily produce a highly visible return for as much as a generation. So given the short-term incentives that drive a lot of local government decision-making, it can be difficult even for the most driven, the most motivated local leader to shift the Titanic, to use a term that Sheila used, getting leaders to spend a lot of political capital on a long-term initiative, devoting precious staff time, and we'll talk more about that in a little bit, towards something that won't feel visible, to risk political blowback for initiatives that are only going to bear fruit, after everyone in the office has retired. So the catalog attempts to confront this just by providing a really clear synthesis of the research on the importance of long-term investments in all of these spaces. So by trying to link each policy area and each outcome to the longer-term economic mobility trajectories that they influence, we hope that this is giving local government leaders a tool to be a little bit extra persuasive within their offices, within partners, to the voting public as they try to stand up new strategies. Our next finding, and this comes from what I had mentioned before on the time dimension for local leaders. It's impossible to overstate the extent to which local government leaders feel pressed for time. The pace of day-to-day work in local government is really intense. So even when there's a lot of momentum around a particular kind of intervention, a lot of the resources that would help inform decision-making are not well suited to that dynamic in City Hall. So we really wanted to boil down with our local leaders, what are the most important dimensions of learning about a new evidence-based strategy that you really are going to be able to consume and then act on? So a few of those I've mentioned here. What are the outcomes that I can expect from this strategy? What is this going to cost our government per participant or per outcome? What are the sorts of things I need to be thinking about in terms of implementation? And the problem is that there are few resources that are available that discuss these sorts of aspects of programs for local governments. So in the catalog, we have research overviews of nearly 200 programs and strategies, and each overview page is intended to give local leaders a really crisp and concise picture of what each program or strategy does. So what are the basics? What outcomes is this going to generate? What is this going to cost? Who is it for? That sort of thing. These pages also provide just a few high-level implementation considerations and links to a vetted set of resources for leaders who are able to do a deep dive and learn more. So finally, leaders in local government are highly focused on implementation. So presented with a new strategy, one of the first questions you'll hear is, how would I actually get this done? And there's very little material out there that's devoted to the implementation of new strategies and programs available to local government leaders. And without a sense of what it actually takes to execute it's difficult for local leaders to build support. So to address this in the catalog, we include case studies that focus on the specific implementation process that communities experienced in putting into place a new evidence-based program or strategy. We focus on, the specific local challenges that that community was facing, how civic momentum was established in confronting that problem, how the program was adapted to the specific context of that local government, that sort of thing. I know that we're short on time, so with that, I'll cut it. I would love to answer your questions, and I will invite my colleague Maya back to the screen.
Thanks, Ross. And with the little time that we have left, I was hoping that you could just tell us what comes next with the catalog. Is it a finished product, and what can we expect from it?
Yeah, sure. So the catalog is not a finished product, and this user-informed process continues. We've continued to receive a lot of great feedback from local leaders who have expressed an interest in a few different sorts of things. So the first is even deeper synthesis for programs and strategies to help them understand what is the relative impact that this program is going to have if I put it into place. And second, what is the relative complexity of actually implementing this strategy? So that's something that we've heard loud and clear. The second that I'll say is we are going to be significantly building out our case study library. So we're aiming for 50 case studies that tell the implementation stories of evidence-based programs that are in the catalog. And then the other thing that I'd mention is we've heard feedback that an even deeper dive into sub-indicators for the specific outcomes we've identified would be really helpful in helping align stakeholders as folks are coming together trying to address their mobility challenges.
Great, thank you. And thank you so much, Ross, for the introduction to the Economic Mobility Catalog. You all should have a link in the chat, and we hope you explore it further. I'd like to thank all of our speakers and participants today. I hope you found this session informative, and I hope you have a great rest of the day and a lovely weekend. Thank you so much for joining us.